Have you ever felt helpless in your own body, baffled by symptoms that don't have a clear diagnosis? Last year, while working on a documentary, I met a patient at the Marcus Institute who underscored the challenges many patients have when battling complex symptoms. Caroline Santangelo had one of these complex disorders that was a mystery to many doctors. Diagnosed with Ehlers-Danlos, which in itself has a multitude of problematic symptoms, was then complicated by other things going on that were really debilitating Caroline.
Growing up as a child, I was diagnosed with Ehlers-Danlos disorder, which is a connective tissue disorder that affects every system of your body, as well as amplified muscular pain syndrome. I completed a program at the Children's Hospital of Philadelphia where I gained amazing skills to help combat the symptoms. And I thought I had it all controlled and figured out. 3 years ago, the connective tissue in my body was just, everything was affected and everything shut down. And I got to the point where I was unable to eat or drink. I was so dehydrated for so much of the time, from vomiting all the time. And that year I was hospitalized 4 times because of severe dehydration or vomiting blood and different things that we couldn't figure out why.
She shouldn't have been this sick, this young. So that immediately gets your attention. And then she presented with a bunch of different maybe diagnoses. One was Ehlers-Danlos syndrome. That's no way to live. It's terrible pain. It keeps changing. It can be associated. So she has seen a lot of doctors, from rheumatologists to physiatrists. And of course, all the drugs were tried.
So the toolbox of the regular physicians had been exhausted, it sounds. In our journey through the labyrinth of perplexing cases, Dr. Bazzan, the medical director of the Marcus Institute, is known for using precision medicine to solve these so-called medical mysteries.
And our job is to go and peel the onion.
His compassionate approach to Caroline's rare condition reflects our shared mission to always seek answers, even when others throw their hands in the air.
I had daily joint subluxations, constant vomiting, chronic fatigue, lightheadedness, constant constipation, daily burping. So it was just a whole skew of issues that just kept coming up, to the point where you go from being a half marathon runner to being bedridden. And at this point, my family and I, we were just so frustrated with everyone's lack of understanding of my diagnoses and the lack of long-term resolutions. I'm a very strong personality, and I refuse to accept there's nothing we can do as an answer. I'm so grateful that we found Dr. Bazzan, because he really took the lead on my case. That was the first time that I had that, we're gonna heal you, which was amazing.
I love that resilient part of your personality.
Yes.
After thorough genetic testing and microbiome testing, Dr. Bazzan pinpointed Caroline's microbiome imbalance as the epicenter of her health issues.
You've been growing the bacteria that increase the inflammation. Inflammation means the patient is on the stove, is being burnt. That's what flame inflammation means. So where does the fire start? Well, we teach patients that the fire starts in the basement, and the basement is the bowel, the gut. So if you go home and set fire to the basement, the house is not going to be happy because it's going to burn through. And this is usually what happens. When the gut is on fire, the body burns. The approach we take is the rebuilding of the entire system from the ground up. And over time, we have understood that the ground is the microbiome,
Right.
which is the population of bacteria and organisms in the gut. So we go back to that, which is usually not done in conventional medicine.
And that's where Dr. Bazzan came in and completed his comprehensive assessment for all of my systems, all of the testing that he did, as well as provided these life-saving hydration IVs that I needed every single day.
Intravenous is miraculous because now you can go behind the liver and you can go directly into the bloodstream. So when you take, say, magnesium capsule, that's a long road to have to go through the whole gastrointestinal system, go through all the checks and balances, and eventually be released in the bloodstream after the liver let you in. When you do that intravenously, within 20 seconds, it's in the brain. So for a person that has that need, these things are lifesavers.
Every single time there was an emergency, because my symptoms became an emergency a lot of the times, but every time we called, there was, okay, come on in, here's our solution, or we don't know yet, but we're gonna figure it out. And within a day, I always had an answer to what the next right step was. And I think that is so key, especially when somebody is that sick, to have that support.
To summarize, Dr. Bazzan did advanced testing that is typically available to identify a dysfunctional gut that at least was partially due to an unbalanced microbiome, genetic pathways that showed poor nutrient metabolism, and interventions that replenished her natural building blocks and balanced her gut function. It was a process that took time, and there were multiple layers to Caroline's symptoms. She went from being unable to function to married, pregnant, and thriving in her career.
And I'm actually 17 weeks pregnant. And
congratulations.
Thank you. So they were some of the first people to even know that I was pregnant, because it was just so exciting that we went through these milestones together.
Rainy days don't seem so wet. Stormy nights don't stay. From the moment that we met, you were worth the wait.
As we witness Caroline's blossoming into motherhood, a testament to her regained health and resilience, it's easy to overlook the immense challenges she faced. By tailoring treatments to Caroline's unique genetics and microbiome profile, the Marcus Institute turned what seemed to be an unsolvable mystery into a story of renewed health and hope. If you found this story inspiring, please like, comment, and subscribe. We'll have many more like it. Until next time, be well.